How can sensory sensitivities impact medical procedures or hospitalizations?
Yes. So this is a big one. When a child is hospitalized, they're out of their routines, they are out of their comfort. We don't always know, hey, how does that sheet feel on your skin? Because it might feel different than it would to me, right? Also, lights and sounds in hospital, it's a lot. Um, there's a lot of things going on there. It's not a quiet place often. So that can be really overwhelming for clients that are very sensitive to sound or very sensitive to light. Um, One of the things that I think about as a nurse anytime I'm walking into a patient's room is this kind of a new idea to me, which I heard on another podcast about texture. What do you bring into a room? Do you bring in softness? Are you a sense of calm? Are you a sense of patience? Do you come in a little irritated? Are you maybe a little bit bringing friction with you when you don't need to? So I think setting your intention as to what you're bringing into the room and the type of care you're going to provide, especially for a child with sensory needs, you're really going to determine your success, I think, based on how you're able to interact with that child before you do any sort of medical procedure.
Great answer. And a lot of times we help children and adults prepare for these medical surgeries or testing or
Yes.
blood getting drawn or going to the dentist. And the preparation is really key in terms of decreasing fear and anxiety, priming.
Yeah. So I think the dentist is a great example. A lot of our clients really struggle going to the dentist. It's really scary for them. Again, you have lights, you've got sounds you're not used to, you have smells that are maybe overwhelming. And then there's just the fear of pain. Um, I think that we've done some pretty great work of slowly desensitizing the child even before they walked into the office, you know, practicing putting the toothbrush in their mouth and you open your mouth and I'll put something in there and we'll take turns so that we can be less fearful about people approaching a sensitive area. Um, and there are even some dentists that you can make a really good partnership with and practice. We're just going to go and sit in the lobby today. We're just going to go and sit in the chair. You're not going to have an appointment, but we're going to just go into the room and slowly make it more and more comfortable so that the long-term health outcome is better.
Yeah, because if the initial is aversive, um, the child might put up resistance to going. And so I think what you're alluding to is like, at Nurture Nature, we play doctor and we play dentist. And
Yes.
I know that sounds kind of naughty, but what we do is actually we bring out the toy kits and it's like,
We watch the videos. This is what
yeah,
it looks like to go to the dentist. This is,
yeah.
just
And
to
we
help
let
them
them play
prepare.
with the tools and we let them put the mirror in our mouths
Yes.
and we
Yeah.
we play, dentist. And I think that does go a long way empowering the child.
Yeah.
Whenever we like to play vet at the
Mhm.
clinic, and so we bring out the doctor's kits and they're the vet and we have a bunch of stuffies. And every time a child brings out the doctor's kit, they're always like, "You need a shot." And I think that's really empowering for little ones because they're in the control position
Mhm.
and, they get to give you the shot and they're always like, "Did it hurt?" And it's like, "Ouch, yes." And they're like, "Put a Band-Aid on him, make it feel better." It's like, "Okay."
Yeah, it gives them
But
a chance to explore that experience in a
yes.
pretend way.
And also in a powerful way where they
Yeah.
get to take the power. And so
Mhm.
I do think that goes a long way in decreasing anxiety. Some medical procedures you can't prepare for because they're on the spot, and it's like we have to go to the doctors now.
Yeah.
And in that case, it's like bring some stuffies, bring some
Yeah.
friends. Like,
Yeah, and that's something that we've also done with our therapists, have like a go bag. If we're going to the hospital with the client, we have toys, we've got activities, we've got things that will help to make them more comfortable in a strange environment. And especially at a time when maybe it's an emergent situation and we feel like we need to move quickly, just to try to help ease that transition because it can be really scary for the family, but also for the child.
yeah.
Yeah.
We're also so lucky because in Los Angeles, we have Children's Hospital of LA, and that hospital is phenomenal of making it fun. They have it's just
Yeah.
it's fun for the kids to walk into. They've really done a really nice job designing that and making it
Yeah.
very engaging and also very soothing. So sometimes children need to be engaged and sometimes they need to be soothed.